Hi everyone, my name is Emily and today I'll be presenting on Helicobacter pylori, also known as H. pylori. This bacterium is extremely important in human health because it plays a major role in chronic gastritis, peptic ulcer disease, and even gastric cancer. In my presentation, I'll walk through what H. pylori is, how it causes disease, how we diagnose it, and how it's treated. H. pylori is a gram-negative bacterium that thrives in the stomach. It has a spiral or helix shape, although it can sometimes take on a coccoid form when stressed out. It's also microaerophilic, meaning it prefers a low oxygen environment, which makes the stomach a perfect place for it to live. Finally, it's highly motile, which helps it move through the thick mucus in the stomach. Under the microscope, H. pylori usually appears as a single curved bacillus, not in clusters or chains. It has several sheathed flagella located at one pole which spin like a propeller. This motility is one of the main reasons it can reach the stomach lining and colonize it so effectively. H. pylori has several virulence factors that help it survive and cause disease. Its urease enzyme is essential because it neutralizes stomach acid, creating a more comfortable environment for the bacteria. Its flagella allow it to move through the mucus layer. Adhesins like BABA and SABA help it attach firmly to gastric epithelial cells. The CAGA protein disrupts normal cell signaling and promotes inflammation. And finally, VACA is a toxin that damages host cells and contributes to ulcer formation. In terms of disease, H. pylori is responsible for a wide range of conditions. The most common is chronic gastritis, which is inflammation of the stomach lining. It is also a major cause of peptic ulcer disease. In addition, long-term infection increases the risk of gastric adenocarcinoma. H. pylori is also associated with malt lymphoma, which is a cancer of the stomach's lymphoid tissue. Many people infected with H. pylori walk around asymptomatic, but when symptoms do occur, they can include nausea, a bad taste in the mouth, heartburn, bloating, a feeling of fullness, and loss of appetite. Unfortunately, these symptoms overlap with many other gastrointestinal issues, which is why diagnostic testing is so important. This map shows the global distribution of H. pylori. About half of the world's population is infected, but prevalence varies widely by region. Rates are highest in parts of East Asia, South America, and Africa, especially in areas with limited sanitation. These same regions also tend to have higher rates of gastric cancer linked to H. pylori. Humans are the primary reservoir for H. pylori. The bacteria lives in the stomach's mucosa layer and can sometimes be found in saliva and feces. Transmission most commonly occurs through the fecal to oral route or the oral to oral routes. It can also spread through contaminated food, water, or shared utensils. Most people acquire the infection during childhood. The steps for H. pylori pathogenesis firstly begin with the bacteria using their motility to reach the stomach lining. Then they adhere to the epithelial cells using adhesins. After attachment, they release toxins like CAGA and VACA, which damage cells and disrupt normal signaling. As a result, the immune system becomes activated, leading to chronic inflammation. Over time, this chronic inflammation can lead to disease, including ulcers and, in some cases, cancer. This slide provides an endoscopic view of the clinical outcomes associated with H. pylori infection. More than 80% of infected individuals have asymptomatic or chronic gastritis. About 15 to 20% develop peptic ulcers, and less than 1% progress to gastric cancer or malt lymphoma. These outcomes depend on factors like bacterial virulence, the host immune response, and environmental influences. Here's a closer look at disease progression. Most infections begin in childhood. From there, H. pylori can persist for years, leading to chronic colonization. This chronic inflammation eventually results in gastritis. Over time, the tissue may undergo atrophy, followed by intestinal metaplasia. And in a small number of cases, this may progress to gastric cancer. Treatment usually involves a combination of antibiotics and acid reducing medication. Traditional triple therapy includes a PPI, which is a proton pump inhibitor, clarithromycin, and either amoxicillin or metronidazole for 14 days. However, due to the rising antibiotic resistance, many guidelines now recommend bismuth quadruple therapy, which combines a PPI with bismuth, tetracycline, and metronidazole. This regimen has higher eradication rates in many parts of the world. Diagnosis can be done through either non invasive or invasive methods. Non invasive tests include the urea breath test, stool antigen test, and serologic antibody tests. If the more invasive route of endoscopy is performed, an EGD allows for biopsies and direct visualization of the stomach. Biopsies can be tested using rapid urease test or histologic examination to confirm the presence of H. pylori. Recent research has focused on three major areas. First, studies have looked at the interaction between H. pylori and the gut microbiome, which may influence how the infection behaves. Second, vaccine development is an ongoing area of interest, especially targeting proteins like CAGA and VACA. Finally, vamopressin-based regimens, which use a different type of acid suppression, have shown promise in improving eradication rates. This final slide includes the references used to support the data in my presentation. Thank you for your time.